In health news this morning, September is Suicide Prevention Month, and while death by suicide is increasing, recently discovered research is helping with prevention. That research shows that up to 76% of people had contact with their primary care physician in the month prior to their suicide instead of meeting with a mental health professional. Joining me this morning is Dr. Litt and clinical program specialist Jody Sprague. Thank you so much for being here with us this morning to talk about this very serious topic.
Thanks for having us.
Absolutely. Jody, let's start with you. So what is Spectrum Health doing now that they're aware of this key information that we just touched on?
We've got taken several steps because we're very committed to prevention and saving lives. We have trained every employee in each of our Spectrum Health primary care offices. That's about 4,000 people throughout the region, so that they can compassionately address the needs for suicide. In most of our offices, we've added some behavioral health specialists, which are social workers that are right in the office, and they can address those needs, most mental health needs, right in the privacy of the doctor's office. And we've started what we call our next vital sign, and that is historically you would have your blood pressure, your height and weight. Now we've added a screening tool for depression and anxiety so that we can do that. We have social workers in the emergency department, and then we've leveraged our MedNow capacity, which is by video stream like a Skype or a FaceTime. And so we can offer the psychiatry services in the region where they don't have access to as many resources out there.
Right. I like the Next Vital because it's one of those things where maybe it's not information they're just going to willingly offer up. Right. If they're asked about it, maybe there's a chance that you can get that out of them, correct?
And we can address that early on.
Yeah, absolutely. So, doctor, if people are watching right now at home and they've had suicidal thoughts, or maybe they have someone in their family or a friend, what should they do?
Yeah. So the key is, to recognize and tell, as we say it. So recognition means recognizing that you are having those signs, and then also recognizing it in your family members, friends, and bringing it up to your physician. So with the recognition, the signs that we're looking for is lack of interest in the activities that you would normally enjoy, change in appetite, be it either too much or too less, change in sleep patterns, weight loss. So all of these are signs that indicate that there might be something else going on, and then recognizing it in yourself. And if you see one of the family members having those signs, then bringing it to their attention and kind of, if it's an adult, you have to guide it to them to bring it to the next physician appointment, or if it's urgent, actually calling the physician and getting a sooner appointment if available. And then telling is essentially telling it. Recognition is you're just being aware of the signs that you're experiencing, but then bringing it to the attention of somebody else. Again, if you don't feel comfortable discussing it with your physician, bringing it up to your close friend, a relative that you confide in, and then maybe that relative can actually go along, accompany you to your physician's appointment. And if you see it in somebody, you can actually indicate that person that I would be willing to accompany you to that appointment, because a lot of times we see patients not, as you said, they won't bring it up unless you ask them, and sometimes even if you ask, they're kind of hesitant because it's kind of a very personal feeling that they have. So if somebody is there to accompany them, that would be nice. Otherwise, so sharing it with the physician, and then that can be addressed. So once they are recognized, they are told, then we can address those symptoms.
Sure. What if they need immediate attention?
Then you have to actually, if we feel that somebody is actively suicidal, you have to stay with that person. Do not, leave them alone. Call for help, and then actually, anything that you see in the surrounding which can be at risk, like if there is any weapons involved, any drugs involved, any sharp objects, you have to actually remove them. So staying with the person, removing any threatening objects or things that might be present, and then calling for help for that person.
Sure. And there's an 800 number that's listed right there on the screen for National Suicide Prevention, but also just calling 911, is that also an option, correct? I mean, that's also an answer to try to get the help there immediately. So what resources are available out there for people to walk them through this through Spectrum?
There's a 24-hour hotline for suicide prevention, which I believe is on your screen, and then we also have a military hotline that's 24 hours a day. You can also call your community mental health, and of course, call your doctor's office, and we will get you in as soon as possible, or take them right directly to the emergency room if it's, and you just need to get to someplace.
Sure. And people need to realize their family history, right? Sometimes this is something that runs through our bloodline.
Yep. Again, going to your doctor and reviewing those histories. Yep.
Okay.
Very important.
Thank you very much. Very important information.
Thank you.
Sure.
Thank you.